Want to film everybody?
Imagine, you're at a family gathering when all of a sudden you start sweating profusely. You have terrible chest pains and shooting pains going up and down your arm. You start to panic. Knowing that this is no ordinary battle of heartburn, you tell your family members that they need to call 911. The scenario is not so far-fetched, for in 2005 and 2006, the Center for Disease Control estimated that 30.5% of Americans have the high risk factor of high blood pressure for heart disease. However, do not be afraid, for today I would like to inform you of a preventative measure you can all take by demonstrating how to take and to interpret a blood pressure in 3 steps. First is to prepare the equipment and the person. The second is to take the blood pressure. And the third is reading and documenting the number. Now, to do this, you are going to need a manual stethoscope and cuff, or you can use a digital automatic cuff and blood pressure monitor like the one we will be using today. You will also be needing a notebook and a pen to write down the date, time, and the reading that you take. Now, once you have everything together, you also need to prepare the person. The person should not have smoked, drank alcohol, or done any strenuous exercise for the past 15 minutes. Once this is ready, you can go ahead and jump to taking the blood pressure. Now, the first step of taking the blood pressure is to make sure that the person is positioned right. The person needs to be sitting straight in the chair, feet flat on the floor, legs uncrossed, with their lower arm supported, palms up, and upper arm level with the heart. Once they are positioned, you need to make sure that the upper arm is clear for the cuff to go on. If it's not, just roll up the sleeve or make adjustments to where it is. You can now slip on the cuff. The cuff needs to go on tightly, but not too tight. There should be a finger space in between the cuff and the arm. The arrow on the cuff should be pointing towards the bronchial artery. Once this is in place and the person is still and quiet, you may push the start button on the blood pressure monitor. The blood pressure cuff will then inflate, taking the reading. And then start to deflate when it is done. This will take a couple of moments to get it ready. Now, once you have got your reading, you can go ahead and flip the cuff off of the person. Make sure to raise the person's arm above the head and make them do a fist a couple of times to get that blood flowing back to the heart. After you have taken the blood pressure, you need to move on to the third step, which is to read and document the blood pressure. Now, the first number that is located on the blood pressure monitor is called the systolic number. This is the number at which it measures the amount of pressure exerted on the arteries for when the heart is beating. The diastolic number is the bottom number, which is the number that is measured for the amount of pressure on the arteries when the heart is at rest or in between beats. Now, to decipher what range your blood pressure is in, here is a simple chart. Under 120/80 is considered normal blood pressure. 120/80 to 139/89 is considered pre-hypertension or pre-high blood pressure. 140/90 to 159/99 is hypertension stage 1. 160/100 to 179/109 is hypertension stage 2. Now, if you have 180/110 or above, you need to seek medical attention immediately before damage occurs in your heart and in vascular damages. However, if you have 180/120 or above, a hypertensive crisis is also being taken place, and damage has most likely already occurred. The next step will be to document what you read if you are not seeking medical attention. You will need to put the date, time, and the number for which you read. The number is to read as a fraction. For example, 120/80. So like for today's date, I would put 6/29, and the time is about 12 o'clock, and the reading was 153/68. Now, as soon as you have done this, you are done. Pat yourself on the back because you have just made a healthy choice in maintaining a healthy heart. So remember, by maintaining a healthy heart, you can do 3 simple things, like for taking a blood pressure. Those 3 things are to prepare the equipment and the person, 2, take the blood pressure, and 3, record and document the number. Thank you all for listening and watching my demonstration, and I hope to see none of you in my hospital anytime soon.